All right, so Danny, you're going to start doing insurance calls now that you're here at Scripps Rock Dental.
Okay.
One thing I haven't done is I haven't made sure that you fully know all the terms. So I'm going to go through before you call insurances. I just want to make sure that you understand kind of what you're asking.
Okay.
Can you tell me the difference between a PPO and an HMO insurance? Do you know?
HMO typically has a dentist name or a provider on their insurance card.
Yep.
And a PPO doesn't.
Yes.
That's the biggest thing I know the difference of.
Perfect.
Okay.
Yeah, so if a patient calls you and if they don't know if they're in an HMO or not, you ask them on the card, do you see a doctor's name? Most of the time that's a big red flag that it's an HMO if they have a doctor's name on there because they can only go to that one doctor. Okay? And anytime an HMO patient calls in, they're not going to get any benefits coming to our office because we're not in network for the HMOs. Okay? So then with the PPOs, so now you're calling insurances. Do you know the difference between in and out of network when it comes to PPO?
If we're in network, then, which we're not for most, if we're in network, then we have lower, they pay less out of pocket, and if we're out of network, then they pay more out of pocket.
Yeah.
Insurance pays less on it.
Yeah. So the way it works is if the reason doctors join PPOs is because they get on a list. They discount the fees for the patient, and in return, they get on a list. So if a patient needs a dentist, they can go to the list and go, oh, this doctor's in my insurance. So it's sort of like an exchange with the insurance.
Okay.
We're not doing that. We're not in network because we do marketing and we get new patients other ways. But the difference is we don't have to follow what they call a fee schedule. Okay, so those doctors follow, like MetLife, they follow their fee schedule when you're in network. What we are is we're considered UCR, or usual and customary. So these are just our normal fees versus what the insurance will pay. Okay? So then when you call the insurance, some of the things we want to find out are just like what their annual maximum is. You know what that is?
Mm-hmm.
What's that?
It's the, maximum per year that they can use of their insurance.
Perfect. And then it's per patient. So each patient gets $1,000 or $1,500, something like that. Sometimes there's a family maximum, but most of the time it's just per patient. Okay. Deductible. You didn't know you were going to get quizzed on
video,
right?
I should know exactly what that means.
That's okay. You're new.
Deductible, it's a certain amount of money that they have to put down or that they have to use up before the insurance can actually start making a claim?
Yeah, it start paying. Yeah.
Okay.
So the first amount is the first. So if it's $50 and the patient has to pay $50, then the insurance will kick in. Or if it's $25, and they only pay it once a year. So when you're calling to verify the insurance, the reason we want to know what their deductible is and have they met it. Because if they haven't met it, that means they have to pay us that amount first.
Okay.
Then the insurance will kick in. Okay.